Reading an ABG doesn't have to be complicated. If you follow these 5 steps in the same order every time, you will never feel lost. Step 1. Look at the pH. If it's below 7.35, the patient has acidemia. If it's above 7.45, the patient has alkalemia. This tells you whether the blood is acidic or alkaline. Step 2. Identify the primary disorder. Look at the bicarbonate and carbon dioxide. If the bicarb changes in the same direction as the pH, it's a metabolic disorder. If the PaCO2 changes in the opposite direction of the pH, it's a respiratory disorder. Ask yourself, what is causing the abnormal pH? Step 3. Check for compensation. The body always tries to move the pH back towards normal, but it never overcompensates. For metabolic disorders, the lungs adjust the PaCO2. For respiratory disorders, the kidneys adjust the bicarbonate. If the compensation isn't what you expect, suspect a mixed acid-base disorder. Step 4. If it's a metabolic acidosis, calculate the anion gap using the formula sodium minus the sum of chloride and bicarb. A high anion gap suggests acid accumulation, while a normal anion gap points towards bicarbonate loss. Step 5. If the anion gap is elevated, calculate the delta gap. This helps you identify whether another metabolic acid disorder is present. If the increase in the anion gap matches the fall in bicarbonate, it's a pure high anion gap metabolic acidosis. If they don't match, there's likely a mixed metabolic disorder. Let's put that into practice. Imagine an ABG with a pH of 7.28, PaCO2 of 28, bicarbonate of 13, sodium of 140, chloride of 100. First, the pH is low, so that's acidemia. The bicarb is low, making this a metabolic disorder. The PaCO2 is also low, showing respiratory compensation. Next, calculate the anion gap. 140 minus 100 plus 13, 27. That's a high anion gap metabolic acidosis. Finally, compare the delta anion gap with the delta bicarbonate to determine whether a second metabolic acid disorder is also present. That's it. 5 simple steps. Identify the pH, determine the primary cause, assess the compensation, calculate the anion gap if it's a metabolic acidosis, and use the delta gap if the anion gap is elevated. Follow this sequence every time, and ABGs will become much easier to interpret.